Hi, everyone. This is Sam Collins, your coding and billing expert for acupuncture and the American Acupuncture Council, with another episode to always make sure that you're on point and making sure your practice is continuing to thrive and to grow. Our goal with the American Acupuncture Council and my service, the network, is to always help your practice be the best it can be in implementing the care for your patients and ultimately being paid. Well, one of the things that comes up, and I've had this question quite a bit from members, is there some sort of limit to the amount of acupuncture I may provide someone? And that's a question. Certainly, some people think, well, can I only do two? Can I do four? What is my protocol? Is there some sort of limit that I must follow? And in a way, yes, but in a way, no. So let's talk about that. Let's go to the slides. Let's talk about what's going to the type of acupuncture you're going to do and what are the limits. So from here, you can see just my basic information. There's our website, my email address for those that need some extra help. But let's talk about the care of a patient. Let's talk about what is reasonable or what is necessary. And what I'd say that always comes back to is medical necessity. So I'd say the limits to acupuncture, more than anything, is going to be, what does the patient need? What is medically necessary? Well, let's define that. Here's a statement from Cigna Insurance, specifically on their acupuncture policy, which, by the way, just recently updated. And it says medical necessity decisions must be based upon patient presentation, including diagnosis, severity, and documented clinical findings. So, in other words, the more severe the case, obviously, the more severe the diagnosis, the more care they may likely need. So, you'll see here, they're not really putting a limit per se. What they also indicate is that an individualized treatment, meaning frequency, duration, and so forth, is appropriately correlated with the clinical findings. So again, it goes back to severity. So when someone says to me, Sam, is it okay I do 4 sets? I'm going to say it can be, but it's got to be, that's what's needed. I would be careful of it being something that's based on my style, that everyone gets 4 sets no matter what. It should be based on what the patient needs. Well, let's give one more. Let's take a look at what Aetna says. And this is Aetna's Clinical Policy Bulletin, which has also just been republished again, but for 2022. And it says this: acupuncture services are considered medically necessary only if there is a reasonable expectation that acupuncture will achieve measurable improvement in the patient's condition and is reasonable for a predictable period of time. In other words, we're showing we're making the patient better. So what I'm trying to highlight here is that they don't really give a definitive that you can or cannot do whatever is necessary. In other words, could some patients get better with 2, maybe 3, or even 4? Well, here's something that came out, and we've had a lot of offices gotten letters like this. Here's one from the company Empire, which is out of New York, but this is an Anthem company, and we've seen this across the U.S. Of course, I teach seminars all over, and you'll see here it says, the review indicated your average utilization of acupuncture sessions of 1 hour are greater, or 1 hour or greater for personal one-on-one time is greater than what we consider the average of providers. So right there, they're saying, oh, you're doing an hour, that's greater than the others. Now, you'll notice it doesn't say you can't do it. It just says because you're doing more, they're trying to say why. They're questioning it. But notice what it says here. We are aware of many factors that may impact the coding of your acupuncture services. So they're kind of indicating it if it is with 4. Like I know someone who treats post-surgical. That is her absolute specialty. That's all she does is referrals post-surgical patients. She goes, Sam, I generally sometimes do 2 hours. She's doing 6, 7 sets on these patients. But when you think of it, these are post-surgical patients. Lots of severe pain. So would that be reasonable? Like if they were questioning this, you're going to just have to be able to respond. It's reasonable based upon the severity and need. So is there an absolute artificial limit? Well, in some instances, there is. You've probably seen something what they call the medically unlikely edits, MUE, it's often termed. And you'll see here, this is the United Healthcare's promotion of it. I won't say promotion, but their indication of it. This is set up on a federal level, and it says this. It says, in accordance with the code descriptions and the Centers of Medicaid Medicare Services, meaning Medicare, guidelines, that CMS National Coding Initiative, it says the following are the service limits are as follows. And you'll notice the initial set is 1. Well, of course, how many more sets can you have than the first set? The first set is always 1. But notice the additional sets all indicate 2. So in other words, the amount of sets per this guideline says there's going to be 3 per visit. I will tell you, a lot of carriers have adopted this. I've seen this not just with United. I've seen it with Cigna plans as well, where they're pushing these 3 set part based on this medically unlikely edit. Now, you might look at this and think, wait a minute, are they picking on our profession? Well, not really, because every profession, chiropractors, physical therapists, have limits just like this. And you'll notice here, I've just given a quick list of common codes. Obviously, I put acupuncture, chiropractic. Notice for acupuncture, the 1 initial, 2 additional. Chiropractic's only 1. And then you'll notice certain therapies, like by example, if we move down to massage, you'll notice they allow up to 4, meaning once you go over 1 hour, they're going to say no. And these are kind of artificial limits, but they're just saying they don't feel that often it would be reasonable to do much more than that. So now the issue becomes, if I'm billing insurance, am I limited to this? Well, in a way, it's what the insurance may cover. They may only cover that many. Can you do more? So let's say you're an out-of-network provider and the patient has a policy where it only pays for 3. Could you still do 4 and be paid for 4? You could, but not by the insurance company. The insurance company is going to pay 3. Who would pay the 4th? The patient. So you have to be willing to make sure, inform the patient, well, your plan allows a maximum of 3. However, for your case, I believe we need 4, and here's the additional charge. That's if you're out of network. Here's the downside. What if you belong to an insurance? So let's say you belong to United as a provider. You will be limited to 3. And if you do a 4th, absolutely you can do a 4th, but you will not be paid for it, and you cannot collect from the patient. Because remember, when you join an insurance, you're abiding by their rules, which means if they allow 3, that's the maximum that we can do for reimbursement. If you do more, go right ahead. There's no additional money. So you have to kind of make sure beyond these plans, when you join an insurance, you now will become beholden to these rules. If you don't belong to the plan, you could tell the patient, this is what your insurance covers, this is what we need. And so therefore you do what's medically necessary. Obviously, people want to use insurance and we want to give them the best access, but maybe it doesn't always cover everything. As we've all witnessed, how many of you have been to a doctor and you've had to pay substantial money out of pocket, or things weren't covered because your plan didn't cover? What do? You pay out of pocket. Well, here's one. This is TriWest. Now, TriWest, remember, is on the West Coast, well, basically Texas and west of Texas, that handles the VA. And you'll notice they follow the same thing. 1 initial and 2 follow-ups. So you're seeing this also for the VA side, federal plans, obviously, and realize that's also for Optum, which is part of United. So to answer directly, for some plans, there is a limit of 3. That's payable. That doesn't mean you can't do more. It just means your limit for payment is 3, which means if you're in network, you're stuck with 3. But if you're out of network, can you bill the patient for additional? You'll notice the anthems didn't follow that. I'm going to always say, treat what you need to do for your patient. Treat the patient, not insurance. Remember, insurance is nothing more than an aid, and never feel fully trapped into it. You're going to let someone know, here's what your coverage covers, here's what we need to do, here's the difference. Provide what is necessary for your patient. So if you need to do 4 sets, do 4. But if you're in United Healthcare, you will be limited to 3. So be conscientious of kind of following through and understanding different plans, and understand what your rights are in the sense when you're in network or out of network. Remember, when you're out of network, it's up to you to charge what you feel is reasonable, and the patients can choose or not choose to get it. But bottom line is, you are not limited unless you belong to something. When you belong to something like the VA, oh, they can say 3 or United. And so I will say, though, medically unlikely edits is there. I mean, if you go to a massage therapist and they want to do 2 hours, but the plan only pays 4, who's going to pay for the additional hour? Well, we as the patient, or the patient would. So same idea here. What I want you to take away from this is, do what's medically necessary, do what your patient needs, but just be careful, understanding when you belong to a plan, there can be limits. And that limit is 3. To give you a little history of it, pre-2019, it was actually 4 for manual and 3 for electro. And post-2019, they removed it and went down to 3. Now, the good news to that is, I would suggest that many patients, I know me, myself as a patient, I've often not gotten much more than a 30-minute, maybe 45-minute. I've never had an hour treatment, and I'm not saying anything wrong, but I think most patients can respond. So we want to treat what's adequate. And be careful. If you're doing an hour, and here would be my question to you, Does the patient really need the hour, or are you just doing extra because you're not busy enough? And I'd sometimes be careful of that. Be careful of having a patient that you overdo just because you feel like you want to throw everything at it. Be efficient, be mindful, be helpful. What your patients are looking for is a response to care, whether it's going to take 30 minutes or an hour. So don't put yourself in the realm of limiting, but also bear in mind, what is my cost benefit ratio? And remember, benefits are continuing to increase. Take a look here. Aetna benefit in 2022, it says Aetna will add acupuncture as a standard benefit in new and renewing commercial health plans in 2022. So everyone who has a commercial Aetna plan will be covered. Now, this doesn't mean some of the federal ones, but all the commercial ones will cover, which means greater access. Now, will Aetna limit you to 3 sets? I've not seen them. I will say Optum, United, but not Anthem and Aetna. Bear in mind, again, medical necessity, what comes down to. We want patients, we want access, give them the best help. Understand, do what is medically necessary. We're always here to help. Remember, the American Acupuncture Council, specifically the network, not the insurance side, the network is here to help you. I can become part of your office where you can call me, email me, fax me. We even do monthly Zoom meetings. Take a look at our site, take a look. It's very reasonable, and as well as always gives you access. Have an expert on your staff. Always reach out to us, go to our site, and I'm going to say to all of you, thank you, continued success. Peace be with you, my friends. Catch you next time. Oh, and don't forget, they're going to bring it up on the screen. There is another show this Friday, and it's going to be Michelle Gellis. Please tune in. We're always here to help. Take care, everyone. See you next time.